Namaste students, myself Dr. Neha Sharma, Assistant Professor in Rachana Sharir Department at JAYOTI VIDYAPEETH Women's University, Jaipur. Today I am going to discuss about our topic osteology. In upper extremity there are mainly five long bones: scapula, clavicle, humerus, radius and ulna. Today we are going to discuss about the humerus bone. So humerus is long bone of upper arm. It is the longest bones in the body, which makes it more prone to fractures upon impact. The word humerus comes from the Latin word of the upper arm. Humerus is attached with the scapula and clavicle in this manner. This is the humerus bone. It is longest bone of upper arm. Um, it Because it is a long bone, that's why it it is prone to fractures. Mostly it got fractured by here or here shaft in the shaft part or the head part. Where is the next slide is where is the humerus located? The humerus bone is located in the upper arm. We already seen between the shoulder joint and the elbow joint. This is the shoulder joint and elbow joint is below the humerus bone. Shoulder joint and elbow joint, the shoulder joint also known as the glenohumeral joint. Glenohumeral joint, this because this is a because this is the humerus bone. This is the humerus bone and there is a glenoid cavity is situated in scapula bone. Because of glenoid cavity and humerus bone, it is called glenohumerus joint. After that, it is a ball and socket joint. Ball and socket joints are like this. This is the socket and this is the ball. Ball is get fixed in this socket. So head of humerus get fixed in the socket of or glenoid cavity of the scapula bone. That's why it is a ball and socket joint. The ball is a humeral head and the socket is the glenoid fossa of the scapula. The joint is supported by ligaments and surrounded by the rotator cuff muscles and their tendons. The muscles which participates in this joint are the supraspinatus, infraspinatus, teres minor, subscapularis. These muscles originate on the scapula and insert on the humeral head. Origin and insertion is like from origin is from where the muscle got started. And insertion is to where the muscle got attached. So all these muscles, supraspinatus, infraspinatus, teres minor and subscapularis got originated from the scapula and inserted on the humerus head. This is the anatomical position of the humerus bone. This is anterior view and this is posterior view. In anterior view, greater tubercle is seen on the upper part of the humerus bone. Humerus bone is basically divided into three parts: upper part, lower part, and the middle part is called shaft. So greater tubercle is situated on the anterior part of upper anterior portion of upper part of humerus bone, and lesser tubercle is situated below the greater tubercle. After that, intertubercular groove is there in humerus bone, or in this is the head of humerus. It got attached in glenoid cavity of scapula. Below the head of humerus, in the upper part of humerus, the anatomical neck is situated. This lining is called anatomical neck below the head, and after below the anatomical neck there is another neck, the surgical neck. So surgical neck is situated below the anatomical neck. This is the most common site of fracture: anatomical neck, surgical neck, and the shaft part. After that, in this anterior view, in the shaft part there is a deltoid tuberosity. This elevated portion is called deltoid tuberosity, which we can feel in the bone. When we have a specimen of bone, we can see this deltoid tuberosity. In lower part of humerus bone, there is lateral supracondylar ridge. Supracondylar ridge. This ridge is situated in lower part of humerus. Below this ridge, the radial fossa is also situated. The upper end of radius bone is got attached in the radial fossa. After below the radial fossa there is a elevation, ball like structure, cap like structure. That's why it is called capitulum. In other side of capitulum there is a trochlea. Trochlea means pulley shaped structure. Pulley shaped structure is called trochlea. This is a medial epicondyle. If we have medial epicondyle, then we also have lateral epicondyle. So medial condyle is seen in the anterior view and the lateral epicondyle is seen in the posterior view. After that, above capitulum and trochlea there is a fossa. One fossa we have already learned. This is the radial fossa on the lateral side. So on the medial side there is another fossa, that is called coronoid fossa. So this is the coronoid fossa. I will explain later the muscle attachment of the humerus bone, where the muscles got attached. In posterior view we already learned about surgical neck and anatomical neck. After in the shaft part there is a groove called radial groove and deltoid tuberosity. This tuberosity, some part of this tuberosity can be seen from the anterior view, and most of the part is seen in the posterior view. Below, in the lower part of humerus bone, there is a medial supracondylar ridge. This is the medial supracondylar ridge. Because it is above the condyle, that's why it is called supracondylar, and in the medial part it is situated in the medial part, that's why it is called medial supracondylar ridge. So only one fossa is left, In posterior view, only one fossa is there, that is the olecranon fossa. In anterior view, there are two fossas, radial fossa and coronoid fossa. And in posterior view, there is only one fossa, olecranon fossa is situated. Now parts of humerus. Parts of humerus में proximal end, body or shaft and distal ends. Three parts are there. Three parts are there. The proximal end, this is the upper part of humerus closest to your shoulder. This is the proximal part. After that, second part is body or shaft. This is the long or middle portion of your humerus. So this is the shaft part, and this is the distal end, which is situated. This is the lower area of your humerus that is closest to your elbow joint. Then we will discuss about the proximal part. Proximal part has a head. The head is nearby hemispherical in form. This is the head part. It is hemispherical in the form. It is directed upward and medialward. This is medialward and upward, and a little backward also. It articulates with the glenoid cavity of the scapula. It articulates with the glenoid cavity of the scapula. This is glenoid cavity, we can imagine. From the glenohumeral joint, we already learned about this joint. The head from about 1/3 of the sphere and this much greater than the glenoid cavity. So this head is size of this head is greater than the glenoid cavity. That's why the shoulder dislocation is most common in young generation or in childhood also. After that, the second part is anatomical neck. This is the anatomical neck. This lining is called anatomical neck below the head of humerus. The line separating the head from the rest of upper end is called the anatomical neck. The anatomical neck is slight narrowing below the articular surface of the head. The head got slightly narrow from anatomical neck. The anatomical neck is obliquely directed, forming an obtuse angle with the bodies, forming an oblique angle from the body. More than 90 or less than 18. It is the best mark in the lower half of its circumference. In the upper half, it is represented by a narrow groove separating the head from the tubercle. Best marked in the lower half of the circumference. Best marked here, and in upper part it is not seen clearly, but it is represented by a narrow groove. In upper part it is represented by a narrow groove. The third part in the proximal end is the surgical neck. The surgical neck of the bone of the humerus is a bony constriction at the proximal end of shaft of humerus. This is the anatomical neck and this is surgical neck. Surgical neck is situated in between the shaft part and the proximal end. It is connecting the proximal end and the shaft part. It is situated distal to the greater tubercle and lesser tubercle and proximal to the deltoid tuberosity. Here we see in the deltoid tuberosity in the anterior view. This is the deltoid tuberosity. We have already seen this deltoid tuberosity. So surgical neck is situated proximal to deltoid tuberosity and distal to medial and lateral epicondyle. The surgical neck is an area distal to the tubercle that is common site of fracture. We can see in this picture that this is the common site of fracture. these three sites are mostly common for the fracture in the proximal part: surgical neck, anatomical neck, and bicipital groove. It makes contact with the axillary nerve and the posterior humeral circumflex artery. One artery and one nerve is passes through here, that is axillary nerve and the posterior circumflex humeral artery. Damage to the axillary nerve affects functions of the teres minor and deltoid muscle. Axillary nerve that passes from the surgical neck. If the axillary nerve got damaged, then the function of teres minor and deltoid muscles got damaged, and resulting in the loss of abduction. So this is the abduction part, abduction movement of the hand. Abduction means to come along the midline from 15 to 90 degrees. Weak flexion and extension. This is the flexion of elbow joint and extension of elbow joint. The rotation of shoulder as well. This is the rotation movement of the shoulder joint, as well as loss of sensation of the skin over a small part of the lateral shoulder. The loss of sensation from this part. The next part is greater tubercle. The greater tubercle or greater tuberosity is a large posteriorly placed projection. So we will discussed about humerus bone in this lecture. We discussed about the type of shoulder joint, the parts of humerus bone, and after that we discussed about anatomical position and the muscle attachment or one or two nerve or artery passing from here. So in next lecture we will discuss about the remaining parts of the humerus. Thank you so much.